rapid access to comprehensive oncology data and survival analysis. This is the OncoToolkit.
Manually staging multiple myeloma, it's complex, it's a time sink, and frankly, it takes hours that you just don't have. What if we could make that process instant? Let's dive right in. So for you, the busy clinician, what this really means is getting an instant, totally evidence-based, and streamlined synthesis of your patient's risk profile. We are literally turning hours of guideline checking into seconds. Okay, so how do we pull that off? Well, first we have to tackle the core clinical challenge. When we're treating multiple myeloma, every single decision is a balancing act, right? On one side, you have the aggressiveness of the disease itself, and on the other, you've got the patient's actual ability to tolerate the treatment we're planning. And that is precisely what this master panel is engineered to do. It synthesizes those two critical pillars you see right here. There's the disease biology, which will quantify using the R2ISS score, and then there's the patient physiology, which will assess using the IMWG Frailty Score. In modern myeloma care, integrating both of these is non-negotiable for every treatment decision.
This brings us to the fundamental choice we're always facing. For a fit patient, we're probably thinking about an aggressive, curative intent, aiming for that deep, durable remission with tools like a stem cell transplant. But for a frail patient, the whole game plan shifts. The focus becomes disease control and, just as importantly, minimizing toxicity. This tool is all about bringing immediate, data-driven clarity to that very decision.
So let's break that down, starting with that first pillar, scoring the disease biology with the R2ISS staging system. The R2ISS is the current gold standard. It's the second revision of the International Staging System, updated in 2022. And it's a really big deal because it takes the older RISS and refines it by incorporating some absolutely critical new genetic data. So naturally, you're probably asking, okay, so what is the key difference? What's the big upgrade from the old ISS to this new R2ISS? And here's the answer. The original RIIS, as you know, combined the ISS stage with LDH and a few high-risk cytogenetics. The key update, the real game changer in the 2022 R2ISS, is the addition of one single, powerful, independent risk factor, 1Q gain or amplification. So how does this new factor actually change the score? It's simple, but so important. The presence of 1Q gain adds exactly half a point, 0.5 points to the patient's total R2ISS score. That's a specific, tangible hit to their overall prognosis. And this is why every single one of those points matter. Take a look at this table, which is based on the D'Agostino 2022 data. It shows exactly how that score translates to prognosis, and the difference is just staggering. A stage I patient with 0 points has a median overall survival that hasn't even been reached. But a stage 4 patient with a score of 3 or more sees that median survival plummet to just 42 months. The stakes are incredibly high. But remember, disease biology is only half the picture. Now we have to assess the patient's physiology, and we do that with the IMWG Frailty Score. This is all about what they can actually handle. The IMWG Frailty Score is so much more than just the patient's age. It's really about their biological age. It systematically scores their functional status, things like activities of daily living, and their comorbidities to get a true measure of their resilience. This brings up a really critical question, one we should all be asking. Why go through this whole assessment? Why not just use the patient's age?
Because the evidence is just overwhelming. A fit patient has an 84% 3-year survival rate. That plummets to just 57% for frail patient. And maybe even more importantly, look at treatment discontinuation. It nearly doubles from 16% to 31%. The data shows that performance status and frailty are far more predictive than age alone. We simply cannot ignore this.
And here's the payoff. The score gives us clear, actionable clinical pathways. A score of 0 means the patient is fit, eligible for full-dose therapy and a transplant. But a score of 2 or more means they are frail. For them, we have to consider attenuated or light regimens to avoid causing unnecessary harm. Okay, so we've covered the science. Now let's see how the OncoToolkit app takes all of this complex synthesis and just completely automates it in seconds. So here we are in the app. Step 1, data input. And you can see right away, the input fields map directly to everything we just discussed. Beta-2 microglobulin, albumin, cytogenetics, age, functional status. It's all right there, designed to fit right into your clinical workflow. And step 2, instant results. The moment you enter the data, bam! The tool calculates both the R2ISS score for biology and the IMWG score for physiology, side by side. You get a unified, actionable assessment that's ready for immediate treatment planning. Now, step 3, and this part is absolutely critical: transparency. We don't believe in black boxes. You can see this link here. Clicking it reveals the full point-by-point calculation, showing you precisely how each final score was derived. You can trust the result because you can instantly verify the logic. But this tool goes way beyond a single patient encounter. Let's look at how it builds a bridge from the clinic directly to your academic research. Every single calculation you perform can be saved. And over time, without any extra effort, each saved result helps you organically build a structured, research-ready patient cohort right here inside the tool. The workflow is incredibly simple. You calculate and save results during your normal clinical work. Then, whenever you're ready, you export the entire cohort to a single, clean CSV file. That file is now perfectly structured for upload into any statistical software for deeper analysis. And that exported CSV is just the beginning. It integrates seamlessly into the broader OncoToolkit research ecosystem. You can take that file directly into our CSV polisher for data cleaning, or, as you see here, feed it into the Survival Analysis app to automatically generate publication-ready Kaplan-Meier curves and statistics. So this leaves us with a final thought to consider. How could having instant, completely transparent, and research-ready risk stratification change not only your day-to-day clinical workflow, but also the very research questions you're able to ask and answer in the future?